kind of this either or, which I find a little bit interesting. I'm curious if you had the same experience. And then the neutropenia, really patients don't feel that. I luckily haven't had any patients that have really gotten in trouble with infections and febrile neutropenia, and I've not had any deaths, although I feel like I have to knock on wood with that. But the problem can be that it's day 1, day 8. And so it can present some problems in terms of use of growth factor and things like that. You can't use growth factor between the day 1, day 8, and so we tend to use it after day 8, long acting, to try to drive that white blood cell count up for the next cycle. But I think you bring up a good point. We've had it around for longer, and so people are kind of starting to get comfortable with it.
Yeah, and I want to retouch on your point with regard to some of the initial toxicities with sacituzumab. I think, again, we're familiar with it, but I do warn my patients that usually the first couple of cycles can be a little bit rocky in terms of schedule because it can get disrupted by the neutropenia, as you pointed out. So certainly prophylactic growth factor is recommended in that setting.